I would like personally to thank Her Honor, Alexia, Professor Webley, and all of you who have come over here, taken your time to, on a Saturday morning, to attend this very important conference. A lot has happened in 1 year. We have now, this is our 10th year as NBC. And I think I would like to say that we, not me alone, but we as a community have progressed on so many levels in terms to ensure that our needs are met. We will never achieve in a short period of time what others have achieved over years and years of trying to be in this space, but we will get there, and I've got every confidence. We've had loads of issues, and a lot of challenges are going to come through. The first and foremost one would be medical examiner. It's still not perfect. You've already heard, and that's why this year's theme was on the medical examiner, because it's 1 year on, and we wanted to make sure that we were able to try and understand whether we could make changes. One of the things we would like to suggest for the medical examiner is the fact that the attendant practitioner's definition should be expanded. Secondly, we did ask, and not only us, but the Jewish community also asked, is that part of the MCCD, when you record, you should have faith recorded. That is the only way we'll be able to find out exactly how many Muslims have died, and also in order, which Dr. Wajid mentioned, about the health inequalities. That's the only way we'll be able to do so. So the only thing they managed to do was ethnicity. Ethnicity is not going to be sufficient. We need to make sure that faith also is recorded. So that's one of the asks we should want to try and do. Thirdly, from the medical examiner perspective, we really do want to make sure that you relook at the staffing levels. Because specifically where areas where there are higher faith deaths, they're not able to cope. And that needs to be looked at as well. So please, can we also have that element of it as well? Fourth, we need to make sure that the training, although taking place, but we need to make sure that there is more availability of GP or community death from attorney practitioners. That, for me, is the biggest problem which funeral directors face, is when there is a community death. So that needs to be sorted out. Fifthly, the money which was given right from the very beginning by the Department of Health and Social Care to trusts, it was supposed to be ring-fenced just for medical examiners. Sadly, that's not happening. Some people are dipping into it for other things. Let's be very clear that if you assured us that it's supposed to be medical examiner funding would be completely ring-fenced, that needs to be taken place account. The other issue which we have problems with is the independence. A lot of people are saying those, and here we should not only look at the Muslim perspective, we should look at this law was not only made for Muslims and Jewish community, it is made for the entire country. So we also have to take that into account as well, and to ensure that there is independence so people can have confidence in this new system which takes place. So why is there a doubt on it? Because people are saying it's sitting within a trust. And the same trust is where the medical examiners are. So that is it's a concern, but obviously I'm sure we'll be able to sort it out. There needs to be uniformity in out of hours. That is very important. In every aspect of it, and I've already mentioned that before, that the National Medical Examiner role and the Chief Coroner role do not have statutory powers. They can only offer guidance. Our request to the Secretary of State for the Department of Health and Social Care, as well as the Minister of Justice, has been to give those two major roles some statutory powers. Then only can they be able to implement changes. Judge Alexia didn't give me any money for it, so don't worry about it. But this is extremely important, because if they don't have the statutory power, how are they going to be able to implement change, or how will it affect whatever needs to be done from our perspective? So the medical examiner system is by large and by far the most important aspect from the community that we would want all those the stakeholders to understand, and the government department to understand what needs to be done in that respect of it. The second part of it be the coronial service. We have been struggling, and once again, it's a postcode lottery wherever you are. Some coroners are exceptional. There are other coroners where we have major, major concerns. That has been brought to the attention of the Chief Coroner's Office, but they have limited powers. And this is becoming a major issue for us in certain areas whereby the coroners are really not responding to the needs of the community. The reasons may be many. It could be resources, it could be other issues, but that needs to be addressed. And in particular, once again, out of hours needs to be re-looked at again. In London, where we are, one of the biggest Muslim population and faith population in the country, we still don't have out of hours. We have been asking for out of hours for as long as Maulana Yunus can remember. I think 15 or 20 years ago, we were discussing the other day, we still haven't got it. There's a small, from the Brent coroner does do so. But the problem, it needs to have a total system available. Even if the coroner is available, the coroner's mortuary is not open. So we're not able to do it. So we really need to have a thoughtful process whereby there is availability. In this day and age, where people have technology, where everything can be possibly done remotely, as shown during COVID, surely we should be able to get to a system whereby we are able to provide this vital service to the community who, if a person happens to die in an Easter weekend on a Thursday, they will not be able to be buried till Tuesday, Wednesday, Thursday, 1 week later. How can, just look at the impact that would have on families. We have known cases whereby families, when they've had to endure that delay, they went to mental trauma. This is not to frighten, this is just to emphasize that this is reality on the ground. And if the government of every previous government, this government, every government has said, bereaved families must be the center of it, then please make sure we do enough to help those bereaved families. That is what our message would be. Once again, we want to make sure, and I know the previous Chief Coroner did a lot of work because he visited all coronial areas. And I know the current Chief Coroner is looking through all those findings. And I'm sure she will come with a very good solution. So you can all be assured that you will have an out-of-hours service 24/7 from the coronial office going forward. We've had challenges. Okay, the coroners has been finished. Now the next one. Remember, fuller inquiry, extremely important. This is something we really need to ensure and reflect upon. NBC has submitted our response to the fuller inquiry. And there are issues there where we as a community will have to step up, because there is dangers which we have not, fortunately, had to deal with in mortuary space at the moment. But that is going to change. We need to make sure, so there will be regulations. And that fuller inquiry recommendation, one of the recommendations has been, is that there should be a statutory regulation or registration for all funeral directors. That has been emphasized. That is due to fuller inquiry. We have been saying this for years, that our industry, the funeral industry, will be regulated. At the moment, what the industry is trying to do is to say, well, let's have self-regulation. But if it does not work, the government is minded to ensure that there is statutory regulation. We are trying our best to inform the government that the majority of the people who provide funeral services do it on a voluntary basis. They're trying to help communities. And if they impose very unimaginable regulations, then they will not be able to provide that service. So there needs to be a balance, and that balance should be where we take into account commercial, but also the community responsibility. Can you imagine during COVID, had it not been for the community trying to step up, we would not have been able to go, period. My colleague Farooq is here from Gardens of Peace. He will tell you that during the pandemic, for the 2 years we were doing from 20 to 2022, we buried 4,000 people of different age groups. And what Dr. Wajid had said as well, young people as well. Now, they need to understand, there may be pessimists, there may be conspiracy theorists, but the fact that we buried 4,000 people on the ground, it was not empty graves, it's there. And when we were burying people, people were putting, the people are fabricating it. There's no way anybody could bury so many people. And I can assure you, those 4,000 graves have got people in them. So and why I'm trying to mention this is because during COVID, we worked as a team. We worked as a community. We raised our expectations. Those who are not able to give ghusl because they were old, young people moved up to that. That level of understanding and working together as a community, we need to make sure that challenge, we need to ensure that we bring that particular feeling back and that community spirit back, that we work together. Here it's not about, I can do this better. No, let's work as a community. Let's make sure we can, working together, bring about change. Working in isolation will never get you the changes you require. That is why we are saying that if you have any concerns, come to NBC. We will do our best to facilitate, to ensure that whatever your messages are will be passed on to the right people concerned. And we will make sure that the changes does take place. Remember, over the 10 years, so many changes have come across. We now get registration services in almost all the boroughs, available on a Saturday and even on a Sunday. That is because we are working as a team and we are passing on the messages to the relevant authorities concerned. The other big problem we have is burial space. That's why we've got the Law Commission over here. Why is burial a problem? Because in certain parts of the country, there is not enough burial space. And for the best part of 15 years, I remember, there was a burial cremation advisory group at the Ministry of Justice. I'm part of ICCM, and we've got the CEO here as well. We have been saying that please look at the reuse definition and what the legislation should be for that. That was part of the solution which we said. But obviously, bearing in mind that the requirements of faith communities may not be the same as the general communities as well. And that is why we also submitted to the Law Commission what we thought should be a reasonable time for reuse of graves. And there is going to be a workshop on the Law Commission's reuse of graves and what the timelines and what they would do as well. There is also new methods being suggested. That before there was only used to be burial and cremation. Now there's all sorts of other methods being suggested. The only thing I will mention to the Law Commission, because they are here in a listening mode. For Muslims, there is no other option. We can only bury. So whatever is being suggested, even if you bring into statute that can allow to do so, Muslims will only be able to bury. And that needs to be taken into account. And this is why I will also request each and every one of you are coming from all over England and Scotland and Wales as well. Whenever you have a local development plan, make sure that there is burial provision there. This is your element to ensure you can feed into it. We will always continue to do so at national level, but for your local level, please make sure that you do that. One of the things we also would like to mention to the Law Commission, currently as the statute stands, a council does not have statutory duty to provide burial space. Please be aware of that. Now, one of the things we have asked the Law Commission is please make that statutory. This has to be an obligation. Remember, we all pay our taxes. We all contribute to it. So therefore, we should be ensuring that at least councils are able to provide that. Why am I raising this now? Because for the first time, I'm hearing councils say, we don't have a statutory requirement to do so, and we've got other things to play for, like housing or whatever that may be. That is not fair on bereaved families. They've worked all their lives. Should they not be afforded a dignified burial? That needs to be done as well. Again to the coroner, sorry for jumping. We need more facilities for non-invasive postmortem. That needs to be done. We think the biggest challenge we face today is the lack of pathologists, and more so in pediatric pathology. That is why we're getting a lot of delays from the coroner's office, because they don't have enough pathologists. It's not a quick solution, but we feel that there are companies and there are people who are providing CT scan on non-invasive postmortem, which we think will be able to help the situation in terms of the current shortages. But more importantly, you will be giving dignity where faith in certain cases require that you do not dissect the body in any shape or form. And that is what our ask would be, is to see what can be done. And the reason why I'm saying is that because there was a pilot study in Leicester whereby every person that required a post-mortem would go through a scan first, and then only would they be passing to the next one should they require further investigation. That has been our ask, and I have said that to the Secretary of State for Health as well, that this is what we need to do. This is all about money. But there are organizations who are willing to put in CT scans at their cost, but they only pay for the actual utilization. But we need to ensure that it's been endorsed by the coroner's offices as well. We need more facilities like the one provided by Professor Roberts in Oxford, where every coroner was satisfied with his or her with his results. So we need, and we ask the coroner to please make sure that there's availability of more CT scans available. And I must pay tribute to the first chief coroner, Peter Thornton. He made in his guidelines that wherever there is a possibility, please offer the families a CT scan. That has taken place right from the very beginning. So please understand that we are doing our best to make sure. Wherever there are CT scans available, I can say that recently in London last year, we had at East London, we had one funded by the borough. So therefore, any residents of that particular borough, the 5 boroughs, they would not have to pay any cost towards the CT scan. That saves family thousands of pounds. There is an issue about cost of burials as well. A number of you have raised that. Well, this is extremely difficult to deal with because it's a question of land value. Obviously, the government are doing their best, and I must concede over here that the government did and are doing as much as they possibly can to help vulnerable families. The level may not be as much as we want to, but at least they're trying to do so. If the SF200, which is there from the DWP, can pay up to £1,000 towards the funeral cost, and they can also pay towards the actual grave cost as well. So there is help available. There are organizations. We also have one, Muslim Burial Fund, where if families cannot afford, then we will be able to provide that particular support where it's required. The caveat is we would have to do our due diligence, because sadly, we have found that people might try to pass a fast one with us, and it's not easy for us to do so. So there are facilities. And one of the things we should be grateful to Theresa May is that she introduced the Child Funeral Fund, CFF. And sadly, even today, since she's introduced it, a number of funeral directors are not utilizing the CFF. That is, I think, you really need to do so. And if you look at our booklet today, there is an article on how you can claim for CFF, and it is generous. So please try and ensure whatever facilities are being available, try and ensure. One of the things I would like to say, a number of times people say, oh, this person is going to be cremated or something like that. In our experience running Gardens of Peace for 23 years, we have never come across an instance whereby we have not buried somebody because of money. So please, sometimes people say that, oh, this is why one of the things you should remember, crowdfunding is very dangerous because you have no accountability there. That is why go to organizations, there's Sadka Jariya, there's so many people who have got a proper robust system in place which will be able to make sure that we are able to do so. My message to the funeral directors. The job you do and this provision you provide, I cannot even start to express what you bring to bereaved families. Whatever service you provide, families will remember for the rest of their lives. And please never ever look at a deceased person as though that person is just simply an object. Think of it that it is your father, your mother, your sister, your daughter that you are handling with. You need to give that level of comfort to bereaved families. You are, after all, the first port of call. They have entrusted you to look after the loved one. And it is your duty to ensure that you provide that dignity, that level of respect to the deceased. You are carrying a big burden on your shoulder. As Maulana Yunus has said before, this is your responsibility. And you were not selected. Allah chose you to provide this service. Think as a blessing. Allah wanted you to do this thing so that you could constantly be remembered that today I'm burying this auntie, tomorrow somebody's going to bury me. Do that, ensure that. And please always respect people. Do not at any stage, as was mentioned before, we do have a lot of fights. Yunus has mentioned before, yes, we are no different. Every community, the moment before even the person has been buried, there's fights going about the inheritance. We are no different. It's going to happen. But one of the things you should do is don't judge anybody. And I think the greatest disease in our community today is we become judge and jury. Remember, it is not you who decides your fate. It's Allah subhanahu wa ta'ala. So please give everybody the due respect that is required. Don't judge anybody. Specifically when you are dealing with sensitive cases, there is no need for you to discuss the nature and the cause of death wide and with everybody. Keep that particular aspect of it because you have been chosen and you have to remain that confidentiality because that's the only way families will trust you. The last message I would like to give, this is not you as funeral directors, but this is you as community members and community leaders. In the last year, and I've already discussed with my scholars, Mufti Zubair and Maulana Yunus, that the number of young people that are dying due to knife crime or murders, and I hasten to add, suicide, has never been higher than ever before. We as a society need to tackle these issues. We cannot brush it under the carpet. We need to challenge and see how we can ensure that this has to be stopped. And one of the things I know, that of the cases we did, at least 3 of them, in each case it was ages between 13 to 18. All 3 of them could not talk to their parents of what the issues were. And sadly, all 3 committed suicide and put themselves under the train. They have gone. Their parents are suffering every single day. We need to take a lead. We need to educate our younger people. We need to ensure that we hold values. This is our responsibility as a community. I urge each and every one of you, if you are not members of the NBC, please become members of the NBC. Please communicate through us, whatever your requirements are. And I assure you, we will do our best to put it to the necessary people concerned. I would like to thank you for being patient with me and listening to, I'm sure half of them must have gone to sleep, but never mind. I'm really grateful for all of you coming here. There are some very important workshops. Please do participate, and you will still have an opportunity for some Q&As after that. Take from this message from today, we will work as a team. We will ensure that we will be together, and we will make sure that every deceased family and bereaved families are treated with respect. Jazakallah khair. Assalamu alaikum.
For a passionate speech. This